go over a few different things. Let's see, where do I want to start? Well, let's start with the kidney for one, and then I'll go over then trace it from the scrotum, okay? So I have your kidney up here. Kind of, you want to pay attention? All right, the kidney up here, the hilus here, the ureter is draining the hilus, going down to the bladder. Okay, so we cut through our ligament on this side, but the ureter would come through this ligament and drain into the bladder, just as it does on this side. And again, it was cut on this side, but you would have the ureter going into the back of the bladder there, okay? Then the bladder here is drained by the urethra, which is this large tube here, okay? Now, when the vas deferens comes in right here, and I'll explain more of the vas deferens in a minute, it comes in at the position of the prostate gland. So we've all heard about the prostate gland, right? And how like males have, you know, their prostate gland examined, right, by like inserting a finger up the anus. So you can see how that makes perfect sense, because this is our rectum right here, right? And so you've just got like some thin tissue here, and then the prostate gland is right there. So you can see why that makes it really easy to feel the prostate gland, because it's the same in humans. Okay, then posterior to the prostate gland, now this is called the urogenital canal, because the vas deferens carries the sperm in here, and then the urethra here also, you know, carries the urine. So at this point, this canal can either be carrying sperm and seminal fluid, or it could be carrying urine. So now, from the prostate gland down, this canal is called the urogenital canal, and that goes all the way down here to the penis, and the tip of the penis here is called the glans penis, and the opening is the urogenital opening. Okay, so that's tracing like the path of urine, right, from the kidney to the bladder, through the urethra, through the urogenital canal, and down to the penis. Okay, makes sense? All right, so then now let's follow the track of the sperm. Okay, so the sperm is produced in the testes, which would normally be housed in the scrotum here. So this little pouch is the scrotum, and the testes would sit inside of that. There would be an epididymis running along the back of it, the head, body, and tail where the sperm matures, the gubernaculum, the connective tissue that attaches it. But we don't have any of that because the actual testes have been removed from the scrotum. It's really important to understand that the testes are outside of the body wall, right? Even though we've opened all of this up, remember that at one point there were abdominal muscles right here, right? So the testes are outside of the body, right, to keep the sperm cooler, right? So the sperm are produced down in the testes and then come up these spermatic cords, okay, that carry the sperm. So the vas deferens is actually what's carrying the sperm. But this is also externally, it's called the spermatic cord, because all kind of wrapped up in this connective tissue is also the spermatic artery and vein that supply blood to the testes and then drain it, okay? So outside of the body wall, this is called the spermatic cord, houses the spermatic artery, vein, and the vas deferens, which carries the sperm. So this is running underneath the skin, but outside of the muscles. Make sense? Okay, then it comes in inserts into the body wall right here through what's called the external inguinal ring, goes through the inguinal canal, and that's I-N-G-U-I-N-A-L, inguinal. And then you can see on this side here, the spermatic artery and vein come out that internal inguinal canal, and then it's been cut, so we're gonna follow it on the other side. All right, let me get my reference here. Okay, so it's cut on this side too, but comes through the inguinal canal, And you can see the vas deferens wraps around the bladder. So this was the lateral ligament of the bladder. So both the vas deferens now are inside the body cavity and come around behind the bladder and then go back underneath it. So you can see a vas deferens here wrapping around and back behind, and a vas deferens here wrapping around and back behind. Does that make sense to everyone? Okay, so then you can see they come together almost like right here. So you've got two vas deferens looping around and going in. They're going in right between the rectum here and the urethra. So they're coming in, going right back in behind here. And then right at the position of the prostate gland is where they insert into the urogenital canal, right, which is just the continuation of the urethra. So the prostate gland here produces seminal fluid, the vas deferens empties the sperm into the urogenital canal, and then now the sperm with the seminal fluid can travel down the urogenital canal, and then this widened part of the base of the penis here, now remember this is all underneath the pubic bone, right, from like the prostate gland down to like the crust of the penis even is like all underneath the pubic bone, okay? And then on either side of the crust of the penis, which is like the wider base part of the penis, is a bulbourethral gland, and you can see the kind of lateral expansions here. Those are the bulbourethral glands, and they produce more seminal fluid. And then that empties into the urogenital canal, and then you have the actual penis here is posterior to the bulbourethral gland, and of course the urogenital canal runs through the penis, and then the kind of outside tissue right here, that's called the prepuce, which kind of like protects the glans penis. Okay, so that's the prepuce, and then the tip here is the glans penis, and then the end at the opening at the very end is called the urogenital opening, right, which is where either urine or, you know, sperm, seminal fluid would come out. Okay, does that make sense to everyone? The part that's most confusing really is how, you know, the vas deferens goes from like outside of the testes, goes through the body wall, and then like behind the bladder to insert into the urogenital canal, right? Because if someone was designing the system, right, it wouldn't make very much sense to make it that way. It's such like a roundabout way of, you know, doing